Hello and welcome to Module 1, Living Kidney Donation. This module will give a general overview of why someone would need a kidney transplant and how a living kidney donor can help someone in need. Most people are born with two kidneys. These organs are located at the back of your body just above your waist. Your kidneys perform important functions, the main being to remove waste and excess fluid from your body. When blood flows through the kidneys, waste and water are removed and exit your body as urine. Your kidneys also make hormones which control things like your blood pressure and red blood cell production. Ultimately, your kidneys need to work well to keep your bones, heart, and body working properly. When a person has kidney failure, their kidneys no longer work well enough to meet their body's needs, and they can become very sick. There are two main ways to treat kidney failure: dialysis and transplantation. Dialysis helps a person with kidney failure by removing waste, salt, and extra water from their body. There are two kinds of dialysis: hemodialysis and peritoneal dialysis. Hemodialysis involves a machine that removes and cleans blood before returning it to the body. Peritoneal dialysis involves inserting a tube into the abdomen. Fluid drains in and out of the abdomen through this tube to remove excess waste and fluid from the body. For most people with kidney failure, though, a kidney transplant is the best treatment. Most people with kidney failure will live longer and have a better quality of life with a kidney transplant as compared to dialysis. A kidney transplant involves a person with kidney failure receiving a new kidney from a donor. The kidney can come from someone who has recently died, a deceased donor, or from someone who is living, known as a living kidney donor. The new kidney will do all the things a normal kidney does, and dialysis will no longer be needed. However, a kidney transplant is not a cure, it is a treatment option for kidney failure. Some people may need another transplant in the future. A deceased donor kidney comes from someone who has died. A living donor kidney transplant involves a living person donating one of their kidneys to a patient in need. This act is called living kidney donation, and the living person donating one of their kidneys is referred to as a living donor or living kidney donor. The person with kidney failure receiving a kidney is often referred to as a transplant recipient. Living kidney donors may be a relative, for example, a sibling, parent, child, aunt, uncle, or cousin. A living kidney donor can also be a spouse, friend, or coworker. People can also donate a kidney to a stranger in need. Living kidney donation is possible and safe because most people are born with two kidneys but can lead normal lives with just one. Many people with kidney failure who need a kidney transplant go on a waiting list for a deceased donor kidney. However, the wait times can be long and their health may deteriorate on dialysis as they wait to receive a kidney transplant. In Ontario, depending on the blood group of the recipient, the waiting time for a kidney transplant can be between 2 and 10 years. Unfortunately, 2 to 3 out of 100 people on the waiting list die waiting for a kidney each year. A kidney transplant from a living donor has many advantages in comparison to a kidney transplant from a deceased donor. First, the waiting time for a kidney transplant is much shorter. This may decrease the time that a person with kidney failure must spend on dialysis, or dialysis can even be avoided altogether. Second, the transplant date can be planned ahead of time, thereby allowing time for both the living kidney donor and recipient to plan and prepare for surgery. Third, A kidney from a living kidney donor generally lasts longer than a kidney from a deceased donor and usually works well right after the surgery. At our institution, the probability that someone will be alive with a kidney that is working is higher with a living donor transplant as compared to a deceased donor transplant. You can see these various probabilities on the screen at several time points after transplant, such as 6 months, 1 year, 5 years, or 10 years after transplant. As an example, at 5 years after transplant, the probability that a transplant recipient will be alive with a kidney that is working is 87% with a kidney from a living donor versus 80% with a kidney from a deceased donor. It is important to remember that although we have very good success rates, sometimes kidney transplants are not successful. If this happens, it can be very disappointing for the donor and the recipient. All members of the donor team are here to support you in the unlikely event that this should happen. As discussed, there are several reasons why a kidney transplant from a living kidney donor is the best treatment for someone with kidney failure. Living kidney donors also experience many benefits too. Most living kidney donors feel proud and satisfied with the decision to help a person in need and often feel great joy in seeing the improved health of their transplant recipient. In general, most living kidney donors say that they would make the same choice again to donate a kidney if they could. Most living kidney donors remain positive about their decision to donate and report excellent health and well-being afterwards. As a potential living kidney donor, you should know that living kidney donation comes with some risks which your doctor will discuss with you before the surgery. Living kidney donation is a major surgery, and even though living kidney donors are generally in good health, there are always certain risks associated with surgery. Rarely, after surgery, living kidney donors may experience the following: bleeding during surgery, which may require a blood transfusion. This is rare, and less than 1 person out of 500 people will require a blood transfusion. Development of a blood clot, which may cause leg swelling or difficulty breathing. This is also rare, occurring in less than 1% of donors. All living kidney donors are given a small dose of heparin, a blood thinner, during their hospital stay to decrease the risk of blood clots. An infection, such as a lung infection, skin infection, or bladder infection. Less than 4% of living kidney donors will experience an infection, which is typically treated with antibiotics for approximately 1 week, usually given in tablet form by mouth. A single dose of antibiotic is given in the operating room just before surgery to decrease the risk of infections. A temporary collapse of the lung, which could interfere with breathing. Should this occur, the lung can be re-expanded again. This is rare, and less than 1% of living kidney donors experience this complication. An allergic reaction to anesthesia or a complication associated with any anesthesia and major surgery, such as stroke, heart attack, or death, although this is extremely rare. 1 person out of 10,000. It is important to note that the possibility of developing any of these complications is very small. As you'll learn in the following modules, all potential living kidney donors undergo extensive testing and medical evaluation to ensure that it is safe to donate. Although people can live the rest of their lives with 1 kidney, it is important to think about life after donation. Fortunately, research around the world reassures us that living kidney donors can live long and full lives. Usually, after living kidney donation, kidney function decreases to approximately 65 to 70% of its original level. This slight decline does not affect how donors feel and does not require any specific changes in diet or physical activity level. We recommend that living kidney donors follow the same diet and exercise recommendations as the general population. Kidney function generally declines over time, and this is a part of aging. Living kidney donors have a decline in kidney function that is similar to the general population. After donation, living kidney donors may experience small increases in blood pressure and may have mild protein loss in the urine following their kidney donation, which rarely require treatment. Over the long term, living kidney donors have a slight increase in their risk of developing high blood pressure. However, high blood pressure can be successfully treated with lifestyle changes and medication. Living kidney donors have a slight increase in risk of developing kidney failure over the long term after donation when compared to healthy people who did not donate a kidney. However, this risk is very low and less than in the general population. Living kidney donation does not affect fertility. Living kidney donors are encouraged to discuss their potential future plans for pregnancy with the living kidney donor team. There is a slight increase in the risk of developing high blood pressure and preeclampsia during pregnancy in living kidney donors. Your donor nephrologist can discuss these risks in greater detail with you. After living kidney donation, it is recommended to avoid anti-inflammatory medications such as Advil, Motrin, Aleve, etc., as these types of medications can harm the remaining kidney. Tylenol, when taken as directed, is safe to use after donation. Overall, living kidney donors can return to their normal lives with minimal issues following donation. Living kidney donors are healthy adults who are not undergoing treatment for an infection or cancer at the time of their application. They also must not have any history of prior heart attack, stroke, diabetes, or a type of skin cancer called melanoma. The living kidney donation team will review the health of each potential donor to determine if they are suitable to be evaluated as a living kidney donor. In accordance with the Ontario Human Tissue Gift Act, the Toronto General Hospital and the Ajmera Transplant Centre do not support payment of any kind for organs for transplantation. It is against the law to buy, sell, or otherwise deal in, directly or indirectly, any tissue for transplant or any body part or parts of the body for therapeutic purposes, medical education, or scientific research. If at any time you are approached by a person to purchase or sell an organ for transplantation, please notify the Patient Relations Department at the UHN. You have now completed Module 1, Living Kidney Donation. In this module, we reviewed kidney function, kidney transplants, living donor kidney versus deceased donor kidney transplantation, benefits and risks of living kidney donation, who can be a living kidney donor, and Ontario organ donation laws. In the next module, we will review the living donor evaluation process.